Welcome. We are going to be taking a look at our poster here, Social Determinants of Health, and it is such a vital part of healthcare, especially for an older adult. So first we want to look at why social determinants of health is such an important piece. So when we look at these statistics here, when we think of outcomes, only 10% of it is directly due to the health care, taking those doctor's visits, the medications. Only 10% is due to the actual health care. The other 90% is due to those social determinants of health. The environmental factors, social, how often that person is going out and seeing friends, family, finances are another big piece of those social determinants of health. And as you can see, that is by far the largest part of what affects those healthcare outcomes. A couple of things we want to look at how to screen. There are a couple of tools online that are great to look at, and those websites are listed there. If you'd like to jot those down, those are great tools. They can help you find things to question when you're visiting your patient or your client or their families. Some sample questions you might want to ask those folks. How lonely do you feel? Are you getting out to see those friends, family? If you have gone to church in the past, are you still going, getting that social interaction? How hard is it to pay for food, housing, heating, or your medical care? Again, finances are such a large factor, especially with older adults. They may be on that fixed income. Has lack of reliable transportation kept you from your medical appointments, meetings, going to church, anything like that? A lot of times older adults, they don't have that family there that may be able to help them get to and from. They're not driving anymore. They may not live close to public transportation easily, so they feel like they can't get out, and that's a big part of the social determinants of health. Potential causes that we want to look at. There are three main pillars to social determinants of health, and those are your environment, your economic factors, and your social factors. And then within those main pillars, all of those things you see in there kind of feed off of those. So you see the socioeconomic status, education levels can really affect that. Mental health, if there's an addiction issue in there, that can be a factor as well. So all of those things, loneliness is a big one. So getting out and still continuing to see those people that you've been in the past and still taking part in activities that they enjoy. So one example that we can really look at here is, let's look at social isolation as just one of those factors. And you can see function. So if you're in social isolation, you can get depressed. You're not seeing those people that kind of made you laugh, and you don't get out there. And if you get depressed, depression can actually exacerbate pain. And once that pain is fed a little bit more, you lose function. And then if you lose the function, you get a little bit more depressed, and it goes around and around. But it doesn't just go cyclically this way either. It can absolutely go in reverse. So if you're feeling pain, that pain can make you feel a little bit depressed. You're not able physically to do the things maybe you used to do. And that depression then can limit the function. And again, that function can lead to more pain. The loss of the function leads to a little bit more pain, and it goes. And then all of those can feed into more social isolation. You don't feel that you can get out like you used to. So finally, we want to look at some possible interventions, things that a team, as you get out there, and especially when you look at your simulated patient, you as a team can come together and look at. So some of the things is, where can I go for assistance? Once those determinants have been identified, where can they turn? There's always a place called the ADRC, which is the Aging and Disabilities Resource Center. Area agencies on aging all have an ADRC within them, and there are AAAs located throughout the states, so you can always find those, and they can answer any questions that people have and hook you up with community resources. Some other possible services we can look at, there are home-delivered meals. If they're having problems with nutrition, they don't cook anymore, they can't get out to go to the grocery store. We can look at home-delivered meal services, housing support. If they need any minor home mods to help them within their house, get in, out, and being safe within those homes. We can look at medications management and various things like that. And then once we can also look at the payer sources, how are we going to help them financially? How are we going to help them with transportation? How are we going to help them get those medications that they need and help dispense them, make sure they're taking them properly, when they should, and how much? So there's a few things there listed. We can look at personal funds, if those are available to them. We have the Older Americans Act. There are waiver services available for Medicare and Medicaid folks that can help them pay for things. And there's Medicare Advantage plans available too. It's not traditional Medicare, but they're Medicare Advantage plans that can help with payment on that. All of those, we want to look at the qualifications for those folks and see what fits best for their particular circumstance, and then go from there. So I think what we'd like to do next is do a little bit of an exercise. Awesome. We'll bring some pictures out. And these pictures have a room on them, and you can see it's a bit cluttered, but what I'd like you to do is break into a group and look over those pictures and see if you can find what would be an indicator or a risk factor for these social determinants of health. Look through them. I'll give you 2 to 3 minutes to find as many things as you can. And as you're finding those risk factors, see if you can also think of how you can help that individual get through them, how you can help them solve those issues. Okay, so go ahead and break into 2 groups, and at the end of that 2 to 3 minutes, we'll see which team has the most.
Okay.
See the oxygen.
Well, the makers
Do you think that's?
and the alcohol down
Yeah, definitely
there.
trip hazard.
I mean, there's multiple.
Yeah, the medication's everywhere.
Good point.
Look at all those meds, and then the alcohol
walkers
too,
do
with
that.
any interactions.
So see if you can find some maybe financial indicators in there that gives a clue as to their finances.
And the incontinence pads, so she's not like they're not getting out.
Yeah. Just having the shoes and the dog and the dog's
Just
toys
look at all
is
the
a
clutter.
fall
Like, there's
risk.
just so many tripping
I
hazards.
wonder. You see this? That looks like an obituary, maybe?
Social indicators.
Not very
That's
nutritional.
true.
They're not eating very
Nutrition. Thanks, guys.
And their calendars
there's
not
another
in
bottle.
a place
Thank goodness.
where it would be good
So
to
many
look at.
addictions.
trash is right next to where
Right,
the meds are.
that's-
The meds could easily fall in there.
Might have some sort of incontinence.
Yeah.
Their calendar is down there. You can't probably don't go
Right.
see it there.
Oh boy. Is there anything else? Is this a heated blanket?
Oh, so they're
right
sleeping in the
next to
chair and next to the oxygen. Flame mask.
The slippers don't have a back to them, so that could be a fall risk.
What if they needed to call somebody that might not be in their reach with all this clutter over here?
Honestly, just like all this stuff has to move and move like an open, clean space so that they
Right.
can
I do
walk.
agree.
I think you've got as many as you can find? Good. Okay, we'll start with this group then.
Okay.
Can you list the things you've seen in the picture?
So their walker is in the back behind the chair, so obviously they're not using it. They have different types of alcohol sitting around, so they might need some sort of counseling. And there's oxygen tubing on the floor, they could trip over it. Dog
Absolutely.
toys.
You see the dog toys, they have a dog. Does it look like they're able to get out and walk that dog? So they're probably sitting in the house, not getting out, not getting that physical activity.
Right.
Anything else you see?
Just their medication is very scattered. You have pill bottles everywhere. It doesn't look like they're using the pill dispenser at all.
Good. How about this team over here?
Again, with the alcohol, and it doesn't look like there's some like healthy food, but also with the medications, there could be some interactions, so they're
Right.
not getting what they need.
Very good.
We saw like the obituary in the newspaper, so they could be some sort of depression, and then exacerbated by alcohol use.
Absolutely.
Could be that. And then just everything is so cluttered, so they pointed out that the walker's behind, so they're not moving anywhere. Who knows if the dog's even getting out? It's like the house could smell like pee, poop, and like their trash cans right next to them with the incontinence pads,
Right.
so it's just not
absolutely.
a cleanly environment, and everything on the ground is just a trip hazard for them.
Absolutely. Great job. So what do you think are some interventions that can take place to help this person? What can we help them with? How can we do that?
We can maybe do like home health care to
I do
have
agree.
somebody stop by to make sure and to maybe help clean up things or get some other services for that.
Also, medication administration, or at least organizing it for them, and if they're not able to take it, making sure that they're taking it.
Right. Can also get them connected with DocuDose. That could help them take their medications.
That's right.
Okay. Anything else that we could help them with?
Maybe assess if alcohol is a prevalent problem for them, and if it is, then suggest counseling.
Right. So on your team, you could ask the counselor maybe to do an assessment. Good.
Well, I know like Medicare and Medicaid like sometimes pay for you to see a dietitian if you're trying to lose weight. So maybe make some healthier choices so they can lose weight and move around and get around a little
Very
bit
good.
easier.
Pull that nutritionist in from your team. Good job. Excellent. Okay, yeah, you came up with some very, very good points. So just to review, we want to keep in mind that the majority of the outcomes is due to those social determinants of health, your environment, finances, social, all of those things. You've got those tools you can use to kind of flush out those social determinants for your patient, their families, and their caregivers. Some questions you can think of to ask to get those determinants out. Look at those main causes again. Keep in mind it's social, it's financial, it's economic and environmental. And that things, you know, it's not just one issue, and they can all be intertwined so very much. And then, you know, all those services that are available, how to pay, and always keep in mind that ADRC if there are any questions. Okay, so thank you very much. Thank you.